So good afternoon. It's heartening to see so many people who are excited to spend some time thinking about how we can improve the nutrition of women and children despite the gorgeous scenery and beautiful day outside. It's been an absolute pleasure working with the group that assembled these guidelines, and I have to say I entered this effort with a little bit of skepticism, thinking, well, isn't this something that we know, and don't guidelines like this exist? And the more that we worked on them and thought about these guidelines, I have to say that this was really just an impressive achievement and something that was actually truly lacking. I don't know of anything else like this, so I think it will be a great addition. So I've been asked to talk about the nutrition situation for women in North America. I think this beautiful piece of art really summarizes it. This is it's a painting called Terminal Cartography, which is a map of the major causes of death across the world by the organ that's involved. And if you look at North America, it's rendered in adipose tissue. And this really summarizes the primary cause of morbidity and mortality for at least morbidity for pregnant women and kids, as well as other adults. So when we look at the trends in overweight and obesity among adults in America, we see, not surprising but still startling, rates of rise in obesity, with now half in 1946, in 1962, when this figure began, 46% were overweight, and by 2010, 75% had a body mass index of over 25 being overweight. A third are obese, and now we see that 6% of adults are extremely obese. And even though the U.S. is among one of the worst places in the world, we see actually pretty similar information in other countries in North America as well. So the other issue in North America and in the U.S. in particular is that this is especially a problem of our racial and ethnic minorities. And so those who have lower resources tend to be the ones that are mostly affected. So 2/3 of white, but 3/4 of Black adults and even more Hispanic adults in the U.S. are affected by obesity in the U.S. Canada is better, and I think we notice that walking around the streets, but not so far behind the U.S. And so compared to the United States, we still see about 1/4 of women in this case in Canada who are obese, and just really lagging behind the U.S. a bit. I think that Mexico is now beginning to, really catch up and even surpass the U.S. in many demographics. And so these are some nutritional data looking at obesity by sex in different nutritional surveys in Mexico. So looking from 2000 to 2006 to 2012, the total rate of obesity increased from about 61% to 71%. That's overweight and obesity. And now it looks like the rates of obesity are also about 1/4 of adults, with higher rates in the women compared to the men in Mexico. So a substantial problem throughout the U.S. So, and it's always, I think, worth reminding us that even when you have adequate caloric intake, micronutrient nutrition can still suffer. So we still see substantial problems with micronutrient deficiency. For example, in the U.S., although we see anemia in only about 5% of our moms, 1/4 of them have low ferritin, which is suggestive of iron deficiency. This is also really a problem of when people are starting to take supplements. Most pregnant women in the U.S. are taking supplements, but they're actually starting too late. And so only 2/3 of women are taking folic acid supplementation in early pregnancy, which is when it probably matters, as opposed to 90% of women by the 3rd trimester, at which point there's probably little additional benefit. Iodine is an interesting situation in North America because women are, even though iodized salt is universally available, women are turning away from the table salt that's in the grocery store and starting to consume things like sea salt, which is sort of trendier but also less likely to be iodized. There's been an increasing attention to omega-3 fatty acids as fish consumption declines related to guidelines about avoiding high mercury fish in the U.S., and the estimates are that only about 1/4 of women in the U.S. are consuming the amount of omega-3 fatty acids that are recommended for optimal brain development. So we have nutrition guidelines in all of the North American countries, But as you can see, kind of broken down by country, there's a little bit of variation in what's of interest based on the country. And the U.S., there's a lot of, at least a lot of attention on paper to really many of the domains. Interestingly, in Mexico, you know, less about pre-pregnancy health and more focus on health during pregnancy, less on supplementation in Mexico. There are, again, there's this particular interest in U.S. and Canada around limiting high mercury fish, especially in the U.S., but that fish is a good source of the long-chain omega-3 fatty acids, which are essential to brain development. And all the countries really should be paying attention to postpartum weight loss, but only the U.S. is explicitly advising it. So I think that the key issue is that we know that obesity is a problem, but what we haven't yet grappled with is how to really promote healthy weight and healthy weight gain during pregnancy in this obesogenic environment. It's just a challenge that I think everyone's struggling with. Family planning is going to be essential to optimal health entering pregnancy. This is true in terms of promoting supplement use. This is true in terms of postpartum weight loss for many women. Entering pregnancy at a healthy weight is key, and if women aren't planning their pregnancies, then it's a challenge to get them to be at that good place. And one of the things, though, that I do think that we do particularly well is surveillance, and I think that could be something that other settings take a look at. At least we know where we are. We may not be where we want to be, but at least we know the situation as it is. And so there are surveillance efforts that are undertaken by the governments in all the countries that really give us a sense of how we're doing and where we've been. And hopefully we will be in better places. So I'm just finishing up with I don't know if these talks are available to the group, but all these guidelines are available online, and so if anybody wanted to take a look at the guidelines that are in existing, I've just included some references and services that are available. So I'll pass it on, and with that.